My name is V, and I work for the Coalition of Community Health Clinics as a Cover Oregon application assister. The Coalition of Community Health Clinics is a group of 14 community clinics around the Portland metro area, and we provide healthcare access as well as services to the vulnerable populations, which includes the people who are uninsured, underinsured, and low income.
And my name is Adele, and I also work as an application assister for the Coalition of Community Health Clinics.
And I'm Brianna. I'm also an application assistant working for the Coalition of Community Health Clinics. The benefits of the changes in just regulations with health insurance, to me personally, has been an amazing thing. My mom has been working as a caregiver for 30-something years, never been able to get on insurance. One, because she's not offered them through a job. Two, because she doesn't make enough for most private plans. And three, even if she could apply for a private plan, they'd reject her because she was diabetic and asthmatic. Now that's not going to be playing a role against her, and she could get health insurance.
I would work with undocumented population a lot, and there's a lot of fear around, a lot of fear around if they were to apply, what their information would be used for, and if they could get in trouble. And then on the other side, like the completely other end of the spectrum, people who don't think they would qualify for anything at all because they're undocumented. And so it's kind of why would I apply if I can't qualify for anything?
I work a lot with the Vietnamese community. I was born in Vietnam, so I'm bilingual. I'm fluent in Vietnamese. And as a first-generation college student, I would say that at a very young age, most of us have had to deal with a lot of paperwork for our parents, and just that language barrier that a lot of, I'm sure, immigrants' families face. And it was personally very satisfying to me being able to help alleviate some of that, and to help them navigate through the process. And not necessarily completely eliminate the language barrier, but somehow minimize it. And then just being there and letting them know that there is someone who's willing to help. So that was personally very satisfying to me.
When I'm at the clinic, I would first ask like how their day is going and have like some small talk, because even though it's like kind of a waste of time, it's not a waste of time. It's not what I'm being paid for, like chatting with the patients, but I have to ask them all these questions about their family and their income and their like health needs and the disabilities that they have in their family. It's really private and really sensitive stuff to talk about with someone, especially if you're just walking into a clinic where you've never been before, trying to sign up for something that's really convoluted, and there may be a language barrier. The translated version is it's interesting to navigate. Even if you spoke English and using the English application, it's difficult. So yeah, I try to just kind of talk to them first, and then we would go into other things, and I would determine pretty much from our smaller conversation at the beginning about their income or their job or their work experience, whether or not they qualified for the Oregon Health Plan or for Qualified Health Plan, so that I could give them some idea, an estimation of what they are probably going to qualify for, like what they should expect.
My mom is a single mom too, and I'm the oldest in the family. We live three of us, me, my mom, and my little brother. So it was really hard for us, even though my mom had some health problems too for the past couple of years, but she hasn't been able to get the coverage she needs because she would get rejected from the lottery system. And then now Cover Oregon is out, the Affordable Care Act is out. I helped her navigate that, and I applied to her right away when the application opens. Then that took a long time as well. But I'm thankful that all three members of my family are covered under the Oregon Health Plan now, so we have that peace of mind.
We did have a woman who we needed to expedite her application because she was pregnant. And even though she was undocumented, she would still qualify for CA1 Plus, which is essentially the Oregon Health Plan for her prenatal care and throughout her pregnancy, and get all of her checkups. And that was pretty quick. I had MAs and nurses pretty much consistently asking me every 24 hours, like, oh, well, have we figured out what her member ID is? Like, oh, has she been determined? And it was actually not really the onus of Cover Oregon, but on the Oregon Health Plan, just getting her through that system, because she was determined within minutes. So that was pretty exciting.
2 enrollees, and it was all in the same week even. One I enrolled, and 2 days later he had a heart attack. That was in the ER, and found out he had coverage while they were trying to find a cardio specialist for him. Found out he had Oregon Health Plan coverage via the database, and his stuff already being processed. He just hadn't gotten the paperwork. So that was one of the miracle moments. And then at that very same week, at the end of the week, we had another one I enrolled. And he'd come into the clinic, he was in severe pain. Everybody in the clinic was like, go to the ER, just go. He had already done his paperwork. It had been about 6 days since he had done his paperwork. And we were just like, go to the ER, it doesn't matter. It'll get covered one way or another. Your OHP, it'll be processed. They have that 90-day thing. Just go. And he ended up going to the ER and having his appendix taken out that day. So it was, both times life-saving type events, and both times finding out that they had coverage while in the middle of an emergency.
Well, I met a guy at one of my work sites. He had some very serious nerve problems. He had applied for Oregon Health Plan. I didn't help him apply, but he had applied for Oregon Health Plan, and he was just waiting and waiting. And the nurse at that work site told me too that every day passes by that he waits for that coverage, he's losing some nerve functions permanently. So I went ahead and called Oregon Health Authority and sped up the process, and fortunately I was able to connect with someone, and I think within a week or 2 he was able to get the surgery he needed. So that was very satisfying for me to know, and it showed me that enrolling people through the application is not enough. There's all that health literacy, seeing how do people use this insurance now that they have it.